Well, the head of the Ebola response operation at the World Health Organization, Bruce Aylwood, joins us live now. Thanks very much for hanging on there, Bruce Aylwood. The UN mission chief, Anthony Banbury, says Ebola is winning the race. It must feel like that where you are sometimes.
Well, sometimes it does, but I think more important than whether it's winning the race is who's going to ultimately finish first. And I strongly believe with the step up we're seeing now in the international response, we're going to catch that virus.
What do you accept that WHO was too slow on this one? The MSF says they were, and I quote, screaming at you to scale up your response. Why was it so long?
Well, I think if you look back at the timeline when this virus was first identified in March and the team that actually made the investigation on the ground, MSF were there, the Ministry of Health was there, WHO was there as well. And then if you look at the deployments over the subsequent couple of months...
Why did they say that they were screaming at you in May to treat it like an emergency and nothing happened for another 2 months, which in the history of this disease is an age?
Right. Well, in fact, a lot happened. By the time that we got to those couple of months that you referred to, another 400 people were on the ground responding to this disease. And even when and it was, by the way, back in March, as soon as this was detected, confirmed, it was immediately graded as what we call a grade 2 emergency, which means the resources of the organization are put at the disposal of the country suffering the disease.
Do you think then that your response...
Bit of revisionist history.
Sorry to interrupt. Do you think your response from the World Health Organization has been adequate then, has been enough?
I don't think anybody's response has been enough. This virus, as you've heard from the earlier speakers on the program, this is a very dangerous virus. It's behaving in a way that people had not seen it behave. It's moving faster than we've seen in other environments and contexts. Nobody responded the way that was needed to stop this.
I mean, what's interesting is Kofi Annan just told me earlier this evening he was bitterly disappointed with international governments who didn't get their act together quickly enough. Was that your findings?
I think, this is really a complex situation that you're dealing with. You've got most of the people that would normally respond to any kind of a crisis. I oversee all of our natural disasters, etc. And the teams that we rely on, the international teams to respond to these, they're trauma experts, primary health care experts, etc. Very, very, very few people in the world can scramble to manage something like an Ebola crisis, dealing with what we call a BSL-4 pathogen. There's very, very little expertise. Very few groups have dealt with that, and those that have been on the ground, and they got exhausted in terms of the supply very early on.
But isn't that what the WHO is for? I mean, we know about Ebola, we know it's existed in previous strains. Isn't that exactly what a global health organization ought to be preparing for?
Yeah, absolutely. And that's the reason that the organization works through a huge network called the Global Outbreak and Alert Response Network to ensure that any time there's a dangerous pathogen like this that emerges, we can scramble teams from around the world to be able to manage it. And indeed, that's what was done in this case as well. The problem was, as you've seen, this is now on a scale, and very early on began to emerge on a scale that simply swamped not WHO's resources and capacity, but international resources and capacity.
I mean, when Liberia says, just to come down to the raw figures of this, it needs 85,000 body bags. At the moment, it has 4,900. That is woeful. When it needs gloves, just talking about the simplest kind of preparation, it needs 2.4 million pairs, and it has 20,000. You're not going to get on top of this, are you?
Well, absolutely. We will very much get on top of it. And this was the reason the Secretary General established the United Nations Emergency Mission for the Ebola response. It was very much for those reasons. The sheer scale of the procurement needed, the resources needed outstrip what's out there. And so the whole purpose of UNMIR, the UN mission, is to be able to mount the response, get the muscle behind the kind of needs that you just spoke to.
But when you talk about the muscle,
it's already starting to do that.
Where does that muscle have to come from? Because it sounds as if the countries weren't coming to the table quickly enough. They are your member states. Who let you down?
Well, it's not that anyone let us down, Emily. I think what we need to look at is, as I talked about earlier, you're dealing with a disease, a hazardous pathogen for which very few people around the world had the experience. And even now, with this massive international response we're seeing with the support to Liberia, to Sierra Leone, it takes weeks to put in place the infrastructure needed to manage these cases safely. It takes weeks and months to be able to train the healthcare workers that you talked about to be able to safely operate in these environments.
So
this is not something that can scale as quickly as the virus, unfortunately.
Well, if it's about scale, then do you fear that the worst is still to come on this one?
Yeah, absolutely. This disease is still continuing to expand. Just today, the numbers, the reported case numbers, the cases we know about, went over 9,000. And Emily, that was an unimaginable number for Ebola just a few months ago. And in addition, we're seeing continued geographic spread, and we're seeing continued expansion of the disease in key urban areas. All of those things are very, very concerning. But finally, we're seeing that infrastructure that's needed being built to manage those kind of numbers. We still need, though, the people. We need more people on the ground to help manage these facilities, and we need more resources to be able to run them. We simply have not got the financial resources, let alone the people. We're slowly moving, but hopefully now we're going to see a major step up as the international concern steps up.
Bruce Aylwood, thank you very much indeed. Thanks for your time this evening.